When facing a suspicious tumor related to urological cancers, such as prostate, kidney, or bladder cancer, it can be a treacherous time. And we're here with Dr. Adam Luchey. He's a surgical oncologist specializing in genitourinary oncology. Great to have you with us, Dr. Luchey.
Great to be here.
Thank you so much. And I've had family members go through that sort of, you know, the horrific time of identifying, all right, there's something there, there's a mass. And we're talking specifically about the urinary tract.
Sure.
and that field. At what point during this diagnostic phase do you say, I need to go to Moffitt, I need to make that call? When do you know this, maybe surgery is an option?
Well, surgery is often a cornerstone of treatment care for genitourinary cancers, kidney, bladder, and prostate. But when you come to Moffitt, you're coming to a facility that our goal is the prevention and cure of cancer. As the eminent NCI-designated cancer center in the area, we use a multidisciplinary approach of dealing with all cancers, specifically genitourinary cancers. So when you come to Moffitt, you get subspecialized focused of medical, radiation oncology, clinical trials, and surgeons that come together and individualize a treatment plan for each patient.
And doctor, I have heard that that is something that sets Moffitt apart from others, and that is that you have all those specialists, and that when you have a particular cancer, correct me if I'm wrong, well, prostate is more common, but some of these that we're describing are rarer, and so you need those specialists who've seen this kind of issue before, who've seen these cancers before.
So speaking of surgeons, we are all subspecialized. So we go to 4 years of medical school, 5 to 6 years of residency, then additional 2 to 3 years of a subspecialized, for me, SUO, Society of Urologic Oncology Fellowship. So we get to learn the cutting edge technologies, the updates on clinical trials, so we can individualize patient care and offer a broad range of expertise to these rare cancers that you were talking about.
I see. And so what are you seeing right now? What are some of the new advancements you're seeing specifically in the areas of cancer that you treat?
We are seeing systemic therapy and chemotherapy and immunotherapy, advanced diagnostics for prostate cancer with prostate MRIs and MRI ultrasound fusion biopsies for the diagnostic workup for an elevated PSA, which is a very common thing that we see, and using robotic and advanced surgical techniques to deliver minimally invasive approaches for very complex cancers. You
mentioned the elevated PSCs, right? PSA. You mentioned those, and it made me think to myself, okay, how do you get into Moffitt? Do you need a referral? When you get that screening and you realize I have this issue, does that trigger the ability to go to Moffitt?
Yeah, so certainly when you or a loved one or a patient has an elevated PSA, that can be a scary time. PSA is a normal protein that's in every male's body. Back in the 1990s when it came out, we thought it was going to be a game changer for diagnostic for prostate cancer, but we have since learned that not everyone with an elevated PSA has prostate cancer. So when you come to Moffitt, a patient can be referred or can go through the Moffitt website and self-refer. There's a whole array of genetic testing, biomarkers, MRIs that we can help deliver to that patient should they be worried about their elevated PSA.
That makes sense. As far as, like you said, research, preventative, that's a big cornerstone of what you do at Moffitt as well, in addition to surgery. What are things that we can do as far as preventative goes? I know it's very broad because these are rare cancers. Anything that you can share with us about?
Generally speaking, for cancers that we deal with, kidney, bladder, and prostate, the big one, although it's tough, is to quit smoking and just overall living a healthy lifestyle. For prostate cancer, being screened at the appropriate age of 45 or earlier if you have a family history, or if you develop symptoms such as blood in your urine or unusual pains that could be attributed to cancers.
Well, thank you so much for your time, Dr. Luchey. Great information that we need to hear, and we appreciate what you do as well.
Oh, thank you.